An outbreak of the respiratory virus known as RSV is affecting children all across central Ohio, along with a growing number of COVID and flu cases. We thank you for staying with us. For NBC4 at 5:30, I'm Jennifer Bullock.
I'm Jared Smalley. NBC4's Jonathan Jackson is live tonight with a look at how these viruses are impacting local families. Jonathan?
Yeah, guys, I spoke with a local mother earlier who says on the one hand, she has a young infant son who was diagnosed with symptoms of RSV, and then her husband also had symptoms of COVID just earlier this week. And now local health experts are saying that these are symptoms and cases that more families should expect to see in the coming weeks.
We've been running the gamut of viral upper respiratory infections this season, and they've been going around our house.
For Jessica Hunter, the change in season has brought with it a change in her family's health. Telling us in the past few days, her husband came down with COVID, and then earlier this month, her 18-month-old son, David, suddenly began experiencing symptoms of the respiratory illness known as RSV.
We actually ended up taking him to the ER one night because he had a pretty high fever and just seemed to be breathing a little faster than normal.
She says his symptoms only lasted for a few days, but as a physician, she knows that RSV can be far more severe in children rather than adults.
You know, in most cases, it can be treated at home with just supportive care, but you know, when it comes to younger kids, you definitely want to look for signs of respiratory distress.
And cases of RSV are surging here in central Ohio, according to local health experts.
I mean, last year at this time, you know, I wasn't seeing it daily, whereas today, I mean, I'm seeing probably 2 or 3 patients a half day that have it.
Dr. Michael DiBartola is a pediatrician with Central Ohio Primary Care and says the number of patients he treats with RSV has been much higher this time of year. A message echoed by local hospitals such as Nationwide Children's, who told us, quote, the last week or two feels comparable to a very busy, high-volume RSV winter surge. Meanwhile, cases of flu and COVID are also on the rise, with the Ohio Department of Health having tracked at least 46 flu cases that have hospitalized patients this season. And COVID numbers rose for a third week in a row, with over 11,663 new cases, leading pediatricians to encourage families to get vaccinated and stay at home if they're experiencing cold-like symptoms, especially during Halloween.
It's a good time to try and get creative as a parent. You know, if it's not going to be a good idea to go out and go trick-or-treating because they have active symptoms, you know, try and find an alternative for your child or set something up down the road where they can go, whether it's a neighborhood thing or with, you know, close-knit family members.
While Nationwide Children says they have experienced this volume before, they've never gotten it this early in the season, as they typically see more RSV cases in the winter rather than the fall. Local for you in Columbus, I'm Jonathan Jackson, NBC4.